Hey, welcome team, welcome press, everybody hooked up? No, let's give Stuart a chance. You get a cup of coffee on the way, it's Monday. I am. Listen, I'm gonna have you all, well, you're good? I'm gonna have you all introduce yourselves, so that everybody knows who's here and who's been working so hard. So, take it away. Yes?
Announce myself, I'm sorry.
Yeah, just introduce yourself,
My
tell them who
name's
you are, what you do.
Jessica, and I work for the Fair Hearing Unit for Vermont Health Connect.
I'm Sherry May. I'm a business lead for Medicaid eligibility enrollment, work for Economic Services Division, the Department for Children and Families.
Janet Perry, business lead on Medicaid for Department for Children and Families.
I'm Bob Skoronsky, Deputy Commissioner, Vermont Health Connect.
And Lori Collins, Deputy Commissioner for the Department of Vermont Health Access.
Don George, CEO, Blue Cross Blue Shield of Vermont.
And I'm Bob Dowd with Optum, Program Director.
Justin Tees, the Director of Implementation for the Exchange.
Cassandra Egas, Director of Operations for the Exchange.
Mary Chen, Health Commissioner.
Stephen Cosentino, Commissioner of VIVA.
Lawrence Miller.
Al Cohen, Secretary, Agency of Youth Services.
And I'm Pete Shumlin, Governor. Thank you all for joining us this morning. I'm going to speak very briefly and turn it over to Lawrence Miller, who's going to introduce a few folks, make a few comments, and I'd love to take questions of all of us collectively or any part of us. You hooked up, Neil?
I'm ready.
So thank you so much for joining us. We all know that having Vermont Health Connect work for Vermont is, as we try to sign up as many people as we possibly can through the Affordable Care Act for access to affordable health insurance, having Vermont Health Connect work as it was designed to is the best possible outcome for Vermont. There's no question that the biggest challenge that we've faced since we launched is change of circumstance. Folks who get divorced, have a baby, change other family issues, being able to change that information so that our website will work for them and get them the product they need with a bill in time reflecting what they're actually signing up for. We set a deadline of today to have change of circumstance, the tool designed to help fix the problems that are plaguing Vermonters. And I'm pleased to announce that this team behind me, and some who aren't here, have delivered on that tool. I can't tell you how grateful I am to them. They have worked tirelessly. They have worked weekends, they've worked holidays, they've eaten more pizza and food trying to keep them sustained. But I'm really proud of the team and grateful to them for the work that they've done to get change of circumstance tools up and running. So I want to give a huge shout out to the Vermont Health Connect team, to our contractor Optum, to Blue Cross Blue Shield and MVP, who are carriers who've been extraordinarily helpful in this entire team, and thank you, Don George, for joining us today, as well as to every single subcontractor worker who's been working so tirelessly on this effort. What does it mean? It means that we now have the capability, the tool, to be able to change your circumstance when things change for your insurance. And the outcome of that, as we get it up and running, will be a much smoother system that has been evading us since we launched. When you talk about the frustrations that Vermonters have had with Vermont Health Connect, whether it's billing or other challenges, it almost all goes back to this function. So I'm going to let the team talk a little bit about how we got there, what it will do, what lies ahead for continued work, because we've got plenty of work left to do. But I just want to say thank you to the team for getting us where we are. It has been a tremendous effort, an effort which I've been updated sometimes 3 times a day, sometimes twice daily, sometimes every day. But this has been a team effort that makes me proud of the folks who have worked so hard to try to get this system to work for Vermont. So thank you from the bottom of my heart, and I'll turn it over now to Lawrence to talk a little bit about where we are and where we're going.
So it was just about a year ago that we came to the conclusion that we were not going to be able to complete the project with the previous vendor and began the process of turning around the project, and it has been a long and difficult process. I think today's step where we are is the best indication, though, that we've had, that the project has been turned around and is on a sound path to completion. And a lot of the people in this room and a lot of people in other rooms have worked incredibly hard to accomplish that. The issue here is not about technology so much, though. This is about how do we deliver the customer service that Vermonters deserve. And not having a completed system has been the biggest hurdle to delivering the level of customer service that Vermonters deserve. And being able to make these changes in a normal course of business will be terrific. Now, as I've said, this isn't the magic button that fixes all of the cases in flight. This is the tool that gives us the ability to fix those cases more quickly and to be able to provide better customer service for people who come in the door with change requests going forward. So what I'll do is we'll go through, Optum will speak to the effort here and the deployment, which began, as you know, Thursday night. We'd anticipated that that would take about 36 hours, but they were able to conclude that deployment ahead of schedule on Friday evening. And then a variety of internal user validation tests were accomplished over the weekend, chasing down little issues, differences between the test area and the final. Those were all worked out well, and then we were able to come back up this morning to be able to return to providing normal customer service while the staff in all of these various entities moves forward with the new capabilities that they're going to be training up on and practicing. So I guess with that, Bob, would you like to speak to the deployment?
Sure, thanks. First, before I speak to the deployment, I first want to mention that Optum is honored to have played a role in partnership with the state of Vermont to help enhance the functionality for Vermont Health Connect. And this weekend was an important step forward, as the governor has mentioned, as well as Lawrence, with successful deployment of the automated change of circumstance functionality. We recognize that there's quite a bit of work that lies ahead. And we look forward to continuing to support the state of Vermont with their health insurance carriers in the state to further enhance functionality for the system over the next several months. As Lawrence mentioned, we initiated the deployment activities on Thursday night. System was then brought back up on Friday night for the purpose of the internal validation. Some things were worked through that were what we anticipated, that we would need a little bit of time to conduct the validation steps. And frankly, as we've now opened the page back up to the public, some of these post-implementation steps that we're following are consistent with any type of system post-implementation. So again, from our standpoint, these types of validation activities are consistent with what you would see with any type of complex system deployment. Thanks.
Thank you.
And as I said, that the main thing is how does this affect Vermonters? And this, remember, is both about 35,000 people with qualified health plans as well as a large number of people who are MAGI Medicaid eligible. So to talk about how this affects the ability to serve Vermonters, Cass Gekas, who runs the operations side of Vermont Health Connect.
Good morning. So I want to take just a few minutes to talk a little bit about our before and after picture for Vermonters. I'll start by telling you what you already know is that despite the technological challenges that we've had, our staff have been working tirelessly over the past year and a half to try to keep up with the backlog of change requests. We've processed over 21,000 renewals and tens of thousands COC requests. But I think it's fair to say that that's been a very long road for us, and that process has been both cumbersome and complex for staff. So just to give you a little bit of picture of what I mean, up until the deployment this weekend, if a Vermonter called in to request a change of circumstance, our staff basically had to re-enter the person's application again from scratch. This process could take up to 75 minutes just for that first step. Could involve, 8 to 10 staff as we pass it from person to person. And just once that is accomplished, the case had to then be passed to a specialized team of another, 15 to 20 people to basically process that case manually so that it's updated in our other systems of record. So this includes the premium processor, it includes our carrier partners, our Medicaid systems, and that process was very slow going and could take several months for Vermonters to actually see their change go from end to end, from when they requested it to being updated at the insurance company. So with the delivery of automated change this weekend, we're confident that Vermonters are going to see changes more quickly and accurately than they have before, and luckily for our staff, their lives will be much simpler. All indications are that we're headed in the right direction. During our validation work this weekend, we were able to process changes that used to take 2 hours within 10 minutes. And the key here is that it's really one-stop shopping for our staff. So we don't have to do that manual update in 4 or 5 other systems. They make the change in our system right now in Vermont Health Connect, and it automatically that evening updates in the premium processor system and in the carrier system. So that end-to-end process happens much more quickly for Vermonters. As Lawrence mentioned and others have mentioned, we still have a lot of work to do and to fully validate our systems. We're doing right by Vermonters with this deployment and taking a phased-in approach to training our staff. We want to make sure that our staff are working with processes that are fully validated and that we're headed in the right direction. And so we're very confident from an operational perspective that Vermonters are going to see the customer service experience that they've been waiting for very soon.
So that's the first step in the process, is managing it internally, and obviously where it really matters is whether or not the carriers have the correct information about what the customer needs and has paid for. And Don George is here representing the carrier community. We do have had excellent support and participation with Blue Cross Blue Shield, MVP, Delta Dental. Remember, for every change that we make in the Vermont Health Connect system, they also need to do development and match the changes on their end. And this has been an ongoing process that they've needed to respond to the changes that the federal government continues to put in place and that we continue to push through. Don?
Thank you. Well, as you all know, and as the governor alluded to, the lack of functionality of Vermont Health Connect to be able to process change of circumstance, to literally be able to process the life changes of people who have qualified health plans on the exchange, the ability for them to be able to change an address, add a newborn to their coverage so that they can be confident that their child has access to care, be able to update their subsidy, perhaps increase the subsidy so they're able to defray the cost of their premium of a qualified health plan. All of those things, lacking an automated process, have really been a source of not only frustration, but really grave difficulty for those who must place reliance on Vermont Health Connect to enroll and to help process their qualified health plans. So, when the governor called in early April for an all-out effort by all of those involved to make this, turn this from a manual to an automated and a systemized process, we not only applauded in that, but joined in that commitment. And very much appreciate the significant lift that this has been for Optum and people at the state of Vermont over the past month and a half to bring this system into production. And now that ultimately the system is being taken in production today, and the system's going live, we really look forward to receiving the timely flow of information that Lauren spoke to as a health carrier, to using Vermont Health Connect as a system of record to be able to reflect our customer changes in our own records. And it's really only through this flow of information and by being able to automate all of these life changes for people that are in Vermont Health Connect that we're going to be responsive to them in the way that we need to, in the way that they deserve. So I think that this is a good progress that has been made by Vermont Health Connect, and we look forward to continuing to serve our customers better and better through this process in the future. Thank you.
Before we move on to questions, I get an awful lot of phone calls from frustrated customers. One of the things that they're very consistent about, though, is that the people who do help them on the phone are trying to be helpful and recognize the system limitations that they've been putting up with. Jessica is one of those people who's made some observations in the past about why she does this work, as difficult as it is some days. And just thought it'd be nice for you to be able to hear from her.
So Jessica.
8 years ago, I started in Vermont state government. I decided about 7 years ago that I wanted to join the fight to revolutionize healthcare eligibility, not just for Vermonters, but for our country. We all have a part in that, and this functionality implementation is the thread that will align all the moving parts that have been chaotically floating, preventing timely decisions and accurate coverage for people. Today is a proud day. We're very proud today to assure Vermonters that the services that they're paying for, that they're obligated to purchase through the law, are going to be fair and accurate. That's why we're here today. Vermonters deserve that, and that's what we fully intend on providing for them.
Thanks. So from here, we'll be ramping up, starting with the most basic, operating the most basic transactions, changes of address and things like that, and volume, continuing to work through the most complex cases. Things have been tested, but as I noted, there are differences between, dealing with it in test and dealing with it when you've got all people's actual data. So we expect that to ramp up over the next little while. Cass's team, all the operating teams, the folks at the carriers will be taking a close look at every transaction that passes through over the next couple of weeks to make sure everything goes as expected. The last thing we want to do after frustrating people for this much time is screw their case up in a new way. So, don't expect things to flip immediately, but to be prudent, careful, and responsible going forward. And we are also moving into the planning for Release 2, which includes the renewals functionality and the remaining work that's left to do on completing Vermont Health Connect. So while the technical team can take a moment to say, terrific, they've delivered to their customer, the operating unit, a lot of new functionality. This afternoon, they go back and start the next cycle all over again before they get to go to sleep tonight. But it's been a tremendous privilege to work with folks who are consistently keeping their eye on the ball, and that is improving service for people and making sure we get to a point that people have the level of care that they deserve.